Parents are worried about a range of things when coming on the interventions and meeting professionals for the first time. They're about to meet someone and share really personal information, sensitive information about their relationship with their partner or ex-partner, and also their family. So there can be a real anxiety around being judged. Also, they've had lots of professionals in their lives, maybe a social worker, teacher, health visitor, and it could be someone else that's going to come along and tell them they're not doing something right, and that can feel quite scary. It's also another intervention that potentially might fail them. I think it's really important for the practitioner when delivering the intervention to take a really empathetic approach to the family and, use lots of active listening to show the parent that you're there to support them and really understand what's going on for them. It's really empowering families to be the lead in, their change and their learning. Once the parents start to practice the techniques and the strategies, they start to see the change and they can start to feel quite empowered. Like an example of this is on one of the programmes, there's a monitoring sheet. And so if they've identified a child behaviour that they're finding difficult, they might monitor this. As the weeks go on, we reflect on this at the beginning of the session and they can start to see that the behaviours started to reduce. And that can feel really empowering for a parent.
I think different parents come into the intervention at different stages. So you might have parents who are really ready for change from the beginning. They're active, they take part in every session, they do their homework, and they really hit all their goals that we set at the beginning. And you might have others who might have the same willingness to change, but may have, a lot working against them. So they might hit one small goal, but it'll be a really important goal. A specific example I'm thinking of is a parent who the biggest change that she made was just to tailor the times that she had with her co-parent. So that meant that the child wasn't witnessing lots of conflict, and that was a really helpful thing for that co-parenting pair. We really work with the parents to help them realise the impact of their conflict on their children. We help them realise that actually from a very, very, very young age, their children are able to understand and have an awareness of conflict and heated conversations. In order for parents to come onto this programme, they have to have a referrer attached to them. That could be somebody like their social worker who's working with them long term, or their GP, the child's teacher, etc., etc. So we work with the referrers really to make sure that the parents are very well taken care of. So from the moment that the referral lands on our desk, we speak with the referrer to determine why they're referred, what help they think that the parents need specifically, what are the strengths within the family and how can we tap into that to help the parents. And from there we keep the referrers in the loop about every step of our work. Speaking with parents about the couple relationship, practitioners may feel either they're not well trained for or that it's not part of the remit of their work. So some really simple tips might be thinking about the family that you're working with. Are they going through having a baby or starting a new job? Have they recently lost their job? Are they moving house, moving to a different city? So those are the places where rupture in relationship might occur.